Welcome to Adapt NCLEX video number 7, Maternity Nursing NCLEX Review Practice Question using test-taking strategy to answer questions related to maternity to master it for nursing school and preparation for the NCLEX. Let's get to it. First question, a postpartum client expresses what? Concern because a newborn's eye occasionally appear crossed. Which teaching should the nurse what? Provide? This is what the mother is saying. There's a clue here, test-taking strategy. You don't have to look for time, date, because I've given it to you. It's a postpartum. That means mommy just delivered. And the newborn, probably less than a day old. And then what did the mother see? It appeared that, the eyes are crossing over sometimes. And this is what the mommy is saying. One is getting closer to each other. What do you teach the mother? Is this a newborn normal finding? Would this baby need glasses? Do I begin to patch one of the eyes? Is this a serious neurological problem? What do you think? This is what we call strabismus. It's a common NCLEX question. If you've never seen it before, I want you to read about it because they can ask you. It will appear in the NCLEX or nursing school. You have to know how to teach the parent. That's why the mother is asking you. That's why I'm asking you to. What do you tell the mother? The content here is what I'm going to give it to you. I want you to take a pen and paper and write it down. Very, very important. What do you need to write? That time is very important. We have something we call intermittent strabismus. This is common in newborn because the muscles of the eye are immature. And it can be present for up to 3 months. After 3 months, if the eyes are crossing over, then that's a problem. It's a pathological problem. After 3 months, getting to 4 to 6 months, you have a problem. That means we got to do something about it. But for now, nothing to do. So what should the nurse tell the mother? This is a normal finding. If it persists 4 to 6 months, you may need surgery. You may need to patch the eyes so that it can recover. But which eyes do you patch? The stronger one. That's the most important. And the kid may need corrective lenses and after surgery. So that's the content. After 3 months, it's okay. But after 3 months, 4 to 6 months, when it persists, we have a problem. Strabismus. Know this content. Which interdisciplinary consultation is most appropriate? A nurse is caring for a client admitted with what? Hyperemesis gravidarum. What is the concept? What is the keyword? Hyperemesis gravidarum. When you see that word, you know that this patient is either dehydrated and having problem with dehydration and nutritional problem. Who are you going to call? Occupational therapy, speech therapy, nutritionist, and physical therapy. You know the content. You know the patient can walk. They can do all the skills that they need. They don't need a physical therapy. They don't need occupational therapy. Now you're left with nutrition and speech. Speech, usually swallowing problem. This patient does not have swallowing. They need to eat certain food so that they don't have nausea and vomit on themselves. Therefore, dietitian are the best person to call. Severe vomiting leads to nutritional electrolyte imbalance. So dietitian help with what? Nutritional support and meal planning. They are the best people. Which question should the nurse ask? What do you think? If you are in that situation, a client report breast soreness, my breast hurt, urine frequency, I'm peeing a lot, and I'm tired. Connect the dot. You can see that there's a bunch of, I'll never tell you whether this patient is in the OB clinic or not. Don't expect that. That will give you the answer away. But your breast is a different location, right? Frequency and tired. That means if you draw the individual like that, the bladder is here. You having urine frequency. The breast is here. It's what? Soreness. And the whole body is tired. You have 3 systems involved that tell you something is wrong. There's systemic manifestation. Do you ask them about when is their last menstrual period? Or do you check their leg and see if their ankles is swollen? Or if you ask them if the baby is moving, or whether they have a family history of hypertension. Well, how would asking about family history of hypertension? I never give you hypertension, their vitals. So you don't know whether they are hypertensive or not. That is gone. I did not tell you the patient is pregnant. Therefore, you can't ask if the baby is moving. Well, it's okay to ask for the ankle is swollen, but what information would you give you? I've given you 3 signs and symptoms. Connect the dot. This look like somebody who is pregnant, and therefore ask for menstrual period. That is the content here. This constellation of symptoms is consistent with what? Pregnancy. Symptoms suggest early pregnancy. So find when they are last menstrual period, and that will help you. 22 weeks, second trimester, gestation. Make the following statement. Which one requires follow-up? You have a bunch of them. 4 patients. They are all 22 weeks. What do you think? I feel the baby move every day. What do you think? I have mild heartburn after large meal. I have lower abdominal cramps and back pain. My breasts are getting larger and sometimes leak fluid. Pregnant lady, 4 weeks, 22 weeks. Which of these complaints should make you worry? That's all. Don't make it difficult. Straightforward. I give you the answer. If it's consistent with pregnancy, ignore it. I feel the baby move every day. Good idea. I have mild heartburn after large meal. Of course, when you eat, food stay in your stomach. Because of the big uterus, it pushes on the stomach. You have heartburn, expected finding in pregnancy. If you have lower abdominal cramps and back pain, I think that's worrisome. It sounds like preterm labor. My breasts are getting larger and sometimes leak fluid. Yeah, you got to prepare a milk and your breast is going to get bigger because of estrogen production. Therefore, what do you think? Hey, we should worry about this lady going to preterm labor and therefore require evaluation. 3 is the right answer. The client is admitted with what? Severe preeclampsia. Keyword, as soon as you hear that, I need to prevent seizures. Which action is the next priority? What would you do to prevent seizures? Administer blood pressure medication as prescribed. Insert Foley to monitor urine output, right? Initiate seizure precaution, right? Give the patient magnesium sulfate. This requires some test-taking strategy and think about prioritization. I say the nurse priority, right? Priority means what would you do first, right? I know you have a problem. You have severe preeclampsia. But which 4 options, if you have to pick? Do you treat the blood pressure? Do you insert Foley, initiate seizure precaution, or give them magnesium? There's the content here. You have to pay attention. It's a prioritization. What is going to kill this patient is having seizures. And therefore, what do you want to do? Make sure when they get seizures, they save. Therefore, in every question, when you pick in an answer choice, safety before medication. Always safety before administering medication. Therefore, initiate seizure precaution. I know you're going to get magnesium. I'm going to give it to you. You may need your blood pressure to be controlled. Fine. But the first thing is safety first. This question requires some test-taking strategy and thinking. This is maternity nursing, NCLEX practice questions and answers to answer this question using expert rationale. But pay attention. Seizure precaution before you give the medication to the patient. And you do that all the time, but you don't pay attention. If that brings this patient to you, you make sure the bed rails are up. You make sure they are on their left side. You make sure you're giving them more instruction before you come and give them magnesium drip. You can't just come and hang magnesium drip while you have not initiated seizure precaution. Question 6. Which instruction should the nurse include for a client at what? 5 months gestation? Selected apply. What are you going to teach the patient? They should avoid exercise until the 3rd trimester. They should lay on their back to rest. They should expect glucose tolerance test to be done. They should expect fetal development check on the baby using ultrasound. And then what? Iron-rich food to improve their diet. They should have iron-rich food in their diet. Of course, yes, you should have iron-rich food in your diet to prevent anemia. Glucose tolerance test is done in Glucose tolerance test is done in what? In 24 to what? 28 weeks. So that is in a right range. At 20 weeks, we do fetal development check with the ultrasound. A pregnant lady should not lay on your back after 20 weeks. So that's bad. She's 5 months. That's not good. And then she can continue to exercise as much as possible. So this is the content related to this question. Therefore, iron-rich food, getting glucose tolerance in a few weeks, and then getting ultrasound to look for fetal development. This is very important. 7 questions so far. What is your score? Put it down. Let me know. I know you have 6 out of 6, but this is glucose tolerance test. 1 over. What is your content? You have to know what it means. And then you can teach the patient. That is the key. If you know your concept, teaching, risk reduction, anything they will ask you, you know it. I should avoid eating and drinking for 8 hours before the test. Is that true? I will drink a sweet glucose solution for the test. Is that true? If my result is high, I will need 3-hour glucose test. Is that true? The test helps screen for gestational diabetes. Is that true? That is the concept. Test taking strategy. I see 1-hour glucose tolerance test, and I look for gestational diabetes. Were you pregnant? And if your glucose is high, you have gestational diabetes. Therefore, 4 sound good. I don't know what it means, gestational diabetes, but I know I'm looking for your glucose and you're pregnant. Therefore, you have gestational state, you are in a gestational state, and if you have diabetes, we combine together, we make you gestational diabetes. That's how you name it. If your result is abnormal, yes, you need 3-hour glucose tolerance test. That's the fasting one. That make number 1 wrong because you're not supposed to fast. It's a random test. If 1 is wrong, then I have to drink a sweet glucose solution for the test. That's what you need to do. Therefore, 1 need intervention because she does not understand that you don't need to fast. Just walk into the lab, and then we give you the glucose test, and then we check it 1 hour later. So 1 is the right answer. Which antipathogen client should the nurse see first? A bunch of them. 1 is 36 weeks, 28 weeks, 32, and 30. What are they reporting? Braxton Hicks contraction, headache, and visual changes, occasional heartburn, frequent urination. If you're 20 weeks, the bladder is going to be irritated. You're going to pee all the time. 20 weeks, occasional heartburn is normal. 28 weeks, and you have headache, vision change, that's preeclampsia. 36 weeks, you're going to have what? Irregular contraction. That's Braxton Hicks contraction. Therefore, number 2 is in trouble. We have to do something. Which question should the nurse ask? What would you ask? Pregnant client report urine frequency and burning. That's not good, right? Pain and frequency look like infection. But what do you want to elicit? Whenever somebody have bladder infection, you always want to elicit whether involve the kidney. So this is the kidney. You have your 2 kidney here, and then you have the ureter that connect to the bladder. So if you have bladder infection, this is what we call cystitis. If you go to your kidney, you have pyelonephritis. I don't want pyelonephritis in a pregnant lady. Cystitis is okay, but I don't want any infection because it can cause preterm labor. Therefore, what question would you ask to see if they have pyelonephritis, fever or flank pain? Are you drinking enough water that day? Do you restrict caffeine in your diet? Have you felt fetal movement yet? All of them is not important. The most important is to see whether the frequency and urination is getting worse. Are they having infection? Do you have back pain? Do you have flank pain? Do you have fever? This tell me the infection has gone to the kidney and you have pyelonephritis. Drinking a lot of water, restricting caffeine, and feeling the fetal movement at this stage is not important because of the symptoms the patient is complaining about. Therefore, number 1 is the best answer. The first trimester client report what? Reflux at night. Last question. What do you think? Which instruction should the nurse provide? Selected apply. Look, when you see these questions, you already know this because I can tell you, you know it. This is gastroesophageal reflux. It's the same treatment you give to somebody who is not pregnant. So don't make it like a special pregnant lady should have a special reflux management. It's the same thing. What do you know about gastroesophageal reflux? Well, do you eat small frequent meal? Should you avoid laying down immediately after eating? Do you elevate your head of the bed at night? Do you take over-the-counter antacid for 4 weeks? Do you drink fluid with meal to aid digestion? What do you think? Of course, frequent small meal is much, much better, right? You should avoid laying down right away after you eat, then you reflux. You got to keep your head elevated. You cannot take antacid for 4 weeks. If you got to take it at all 2 weeks. And if you're pregnant, you got to talk to the doctor before. You should not drink with milk to aid digestion. This is going to make things worse. This is Adapting Class, trying to make maternity easy using concept to master your content. Thank you for watching video number 7. Done. Take care.